Hello, future RMTs. Welcome to our discussion about circulating tumor markers, basic concepts, and clinical applications. This lecture will focus about the tumor markers, its application in the prognosis, diagnosis, and monitoring, as well as the evaluation of the cancer. Okay, so let's have our learning outcomes. Our learning outcomes for this lecture is to recall the synthesis and application of tumor markers and actually to analyze the results of tumor marker tests to assess the condition of the patient. From the word itself, tumor markers, therefore, it is nice for us to take note and remember, no, to define first what do we mean by cancer. I would like to inform the body that based on the report of WHO, they found out that, or they said, not found out, they said that cancer is the second leading cause of death in developed countries, and even in poor countries or in a third world countries like Philippines, cancer is a predominant condition, no? Which you can see or you can see in some most of the patient, no? Cancer is a deadly uh, uh, condition. Okay? Now, you might wonder, paano ba nagkakameron ng cancer? Okay? A cancer is a result of uncontrolled growth of cells in the body, no, that develop into a tumor and spread into other areas of the body. Remember, guys, when we said uncontrolled growth of cells, we have what we call, I am sure and I believe that this was discussed to you in histopathology. Meron tayong tinatawag na neoplasm, right? If you still remember neoplasm, okay? Neoplasm is synonymous sa saan? Sa cancer, no? Neoplasm is synonymous sa cancer or sa tumor, rather. Okay? Not sa cancer, sa tumor. Synonyms siya sa tumor. Ano bang ibig sabihin ng tumor? Ano bang ibig sabihin ng neoplasm? There is an abnormal cell, abnormal growth of the cell. Kagaya ng like the illustration here in our slide. That is a neoplasm. That is a tumor. And that tumor will result, no, into cancer. Now, you might wonder, ay bakit nagkakameron ng tumor? The answer on that is because of the activation of the cancer cells na nagiging dahilan, which is the reason why the patient develop neoplasms or what we call abnormality or uncontrolled cell growth of cells. Okay? However, no, magandang tandaan din natin na ang neoplasm naman, hindi porket neoplasm, at the end of the day, it will be considered as malignant or cancer. Neoplasm, neoplasm, siya yung major reason. Okay? Nagkakameron ng bukol. That's why if a patient is having a may napapalpate na mass, no? And the doctor's recommendation is to remove the mass because that mass that can be a tumor. Okay? Tandaan natin yung neoplasm pwedeng malignant and at the same time benign. Swerte natin kapag benign. Okay? Non-carcinoma kapag benign. Pag malignant, that's carcinoma. Okay? Cancer is also a result of what we call formation and spreading of tumors. Formation, when we said formation, that is what we call uh, tumorogenesis. No? Tumorigenesis. Which means formation of the tumor and spreading. And when we said spreading, metastasize or metastasis. That's why you will hear, you will listen or you will encounter later or naririnig nila even before, no? There is a metastasis in other organs. Kapag may cancer ang isang individual, ang isang patient, and the doctor said, no, there is a metastasis. And even because I want you to take note of this, metastasis is also one of the parameters in the staging of cancer. Ibig sabihin, once we said that there is a metastasis of the tumor, It means that it is not confined in one area of the body. It means that the cancer cells are starting to invade other healthy cells. Meron na ring formation of tumor cells. Example of which is if an individual has a ovarian cancer, which later on, pwede magkameron ng vaginal cancer, tumor, breast cancer, eventually into lung cancer, something like that. Or the liver cancer. As we all know, if you still remember, during our discussion, we said that the liver cancer or carcinoma in the liver is not because, or majority of the cancer of the liver, it's not because of the neoplasm or tumors that is developed in the hepatocytes, but rather because of metastasis from other organs. Example, pancreatic cancer that metastasize in the liver. Okay? Huh? Remember guys that mutation uh, includes the activation of the growth factors. Now, these growth factors is also important. Let's say, for example, epidermal growth factors. No? When we say epidermal growth factors, what do we mean? It means that that is a small polypeptide nitrogen that has been identified in many species. I repeat, when we said epidermal growth factors, these are small polypeptide nitrogen that has been identified in many species. And so what? No? I want you to take note that EGF participates in the dermal wound healing, which promotes stimulation, proliferation, and migration of the keratinocyte. On the other hand, you also have what we call oncogenics or oncogenes. What do we mean by oncogenes? No formation or activation of oncogenes. Example of oncogenes that can be activated in terms or in cases of cancer is what we call the CRAS. Or hindi ito yung kaklase mo, na-crush mo. Or yung kung sino man na-crush mo. No? Pag sinabi natin K-CRAS, it means that it is a signaling, it gives signal. No? It gives signal. It is a part of the signaling pathway known as the RAS map. Okay? It is part of the signaling pathway which is known as the RAS map pathway. And so what? No? This RCRAS converts molecule such as GTP to GDP. Okay? Cancer can also be due to the formation of apoptosis. What do we mean by apoptosis? That is the programmed cell death. Tumor suppressors, and cell cycle regulation genes. No? Those are the conditions that triggers cancer. Now, on the other hand, the Philippines, no, even though that we said, nabi natin, that cancer is the second cause of mortality worldwide in developed countries. In the Philippines itself, there are top nine. These are the top nine cause of mortality in relation to cancer. Number one is breast cancer, to be followed by lung cancer. Actually, lung cancer, yung may mga uh, who are addicts sa smoke, yung mga smokers, actually, they are not that prone in lung cancer. Study shows that those people who are vulnerable of developing lung cancer are those who are the housemaids or yung kasama sa bahay, yung mga second-hand smokers. Why? Because they can exhale the nicotine content of the smoke from the cigarettes. The third is the cervical cancer to be followed by colorectal, prostate leukemias, no, liver, neck and head, and even thyroid carcinoma. So these are the top nine cancer in the Philippines. Being breast cancer is the one or the top one. Now, additional information. It is nice to know that cancer can be categorized based on the tumor size. Tumor size, how could we do that? How could we know that? No? Di ba, if you remember in your histopathology class, one of the major function or focus of histopathology class is to detect if there is an abnormality in the structural pattern of the cells. Having said that there is an abnormality in the structural pattern of the cells, it can be neoplasm. Meron din naman mga degenerative changes, like let's say for example, aplasia, metaplasia, something like that. But if that is a neoplasm, then that is cancer. A cancer can be classified based on the size. How can we measure the size? No, through histological techniques or histopathological techniques. Operation, by the way, I'm sorry, operation pala. And through the help of histological techniques or histopathological techniques, this mass or this abnormality in the structural pattern can be identified whether as it is a normal or a benign cell, a normal or a cancer cell. I have here an illustration showing to you how can we differentiate cancer cells from a normal cells. Now, ano yung sabi natin? Yung ating cancer cells not well differentiated. No, I'm sorry. Our cancer cells are well differentiated. Bakit? As you can see here, no, this is our cancer cell. This is the normal cell. You can see the nucleus. This is the nucleus of a cancer cell. In fact, no, the CN ratio, C stands for the cytoplasm and N stands for the nucleus. The CN ratio can also be used to identify the abnormalities in the structural pattern of the cancer. Okay? The regional lymph node involvement, the presence of metastasis. And take note that cancer can be uh, categorized into 4 stages using Roman numerals 1, 2, 3, and 4, being 4 as the terminal stage of cancer. What are the characteristics of tumors? There are a lot of characteristics ng tumor. Pwedeng because of based on its nuclear, based on its cytoplasmic. But what I'm giving to you tonight, I'm sorry tonight because I'm recording at night. What I'm going to give you today is the size, natawa tuloy ako. The characteristics of tumor based on its nuclear details or nuclear changes. Okay? So what are those nuclear changes in the tumor cells or in the tumor? Number one is the size. No? There is an increase in the size. As you can see here, no? This is the normal or the typical cell. There's a variation in size and shape. Ayan, ito na pala eh. No? There's a variation in size and shape. Irregular ang shape as compared to the normal one and bigger. Increase in size and increase in shape. Okay? Increase in size. Sorry, hindi ako makamove on sa pagkakasabi ko ng tonight. Increase in size and increase in shape. What else? What can you observe? O, sagot. Even I can't hear you. Correct. No? Yung pattern. There is what we call irregular pattern. Okay? Irregular pattern of the cancer cells, of the tumors. Okay? What else? There is what we call excessive grouping or crowding. Take a look at this one. Okay? Disorganized arrangement. Crowding to form a cluster. Okay, what else? We also have indistinct cell membranes. No, indistinct cell membranes. What else? We also have what we call anisocytosis and anisokaryosis. Okay? Anisocytosis, anisocytosis, and we have anisokaryosis. Again, what are the changes in the cells kapag mayroon kang tumor cells? Number one, there is an increase in shape. increase in size. Number two, there is an irregular pattern. Number three, there is what we call anisocytosis and anisokaryosis observed in the clusters, observed in clusters. Number four, indistinct cell membrane. Number five, excessive grouping and crowding of the cells to form clusters. Okay? Those are the characteristics of tumors in terms of its nuclear structure. Pero dun cytoplasmic. Pero what can you observe? Ano yung makikita natin? Meron na siyang low affinity sa sa eosine. As you can see, even the nuclei or even the cytoplasm appears bluish in color. Okay? So even the composition of the cells are being affected. Now, like what I've said a while ago, the cancer can be categorized into four stages. Being the fourth stage or the stage 4 cancer is the terminal stage. If the cancer is on the terminal stage or stage 4, metastasis is more common. Again, when you said metastasis, it means that there is an involvement of the other organs. There is the spread of cancer cells in the other organs. Ang stage 1 localized lang. Primarily, the tumor is localized in one area, confined. Okay, example, stage 1 colorectal cancer. But the problem here is, no, the problem in cancer is, mayroon tayo kasing poor prognosis. Ano ibig sabihin natin pag sinabi natin poor prognosis or prognosis? No? When we said prognosis, that is a predicted, no? Yun yung tinitingnan natin, pino-forecast natin. So ibig sabihin, in cases of stage 1 cancer, we cannot even see that the patient is manifesting signs and symptoms of cancer. Usually, cases of cancer is developed or seen on stage 2. I have cancer. Ano ba yan? Knock on wood. I have classmate. I have classmate when I was in high school. No, classmate ko siya nung high school. Uh, she was pregnant that time. She was pregnant when she found out that she has a cancer. If I am not mistaken, ovarian cancer. What happened? She has to decide, together with her husband, whom they're gonna save, the baby or the mother, because the removal of the tumor ay hindi magawa because of the baby ay nandun. Okay? So it was detected stage 2 cancer during the course of her pregnancy. Immediately after birth, nung deliver na yung baby, no, nagkameron na din ng surgical removal of the tumor. And sad to say that the ovarian cancer of my classmate then is classified as stage 4. That's the problem. Mabilis mag-develop. No? Kapag stage 2, invasion of primary tumor through epithelium into the blood vessels. Okay? Stage 3 cancer is migration of tumor into the regional lymph nodes. That's why, if a patient is experiencing cancer, ano yung mga tinitingnan, yung mga lymph nodes, kung meron ba siyang mga kulani? You heard that, right? Meron ba siyang mga kulani? Bakit? Because yung inflammation of the lymph nodes, okay, in the regional lymph nodes is an indication that the patient is suffering from stage 3 cancer. And when we said stage 4, like what I've said, there is what we call metastasis or invasion of tumor into the distinct tissues. Now, how can we classify cancer cells or cancer? In histopathology, we have what we call the TNM stages or system of cancer staging. This is based on the size and extent of the tumor, lymph node involvement, and the presence of distal metastasis. T stands for the score. T stands for the size and tumor. Size of the tumor. T1, limited to mucosa or submucosa. T2, extension into but not truly muscularis propria. T3, invasion of the perirectal fat. T4, invasion of the adjacent structures. When you said N, it is based on N0, N1, N2, N3. No, N is the involvement of the lymph node. So, ibig sabihin, let's say for example, no, your TMN score is T1, N0, M0. No? No? T1, N0, M0. If you have this, okay, medyo ang pangit ata, no? Well, burahin na lang natin. Siguro natatawa na kayo, isip nyo na rin kung ano yung nakita ko or whatever. Kunwari hindi ko siya nasabi. I have no time to edit the video. Wala tayong nakitang ganun, no? We have T1, N0, M0. Okay, what's that? If we are going to classify that, i-underline na natin. T1, N0, M0. Okay, stage 1. Sir, how can you say stage 1? T1, limited to mucosa or submucosa. Andun pa lang siya. N0, no involvement of the lymph nodes. M0, no metastasis. Safe ka pa tayo doon, kapatid. Okay. So N1, fewer regional nodes are involved. More regional nodes are involved. Distant nodes are involved. Ibig sabihin, di ba sabi natin a while ago, if there is a lymph node involvement, okay, stage 3 na yon. And stage 4, and M stands for the metastasis. M0, no metastasis. M1, metastasis. Let's say, for example, T4, N3, M1. T4, N3, M1. Oh, please take note of this. How can we interpret that? Stage 4. Invasion of the adjacent structures. Distant nodes involved. And there is a metastasis. So that is stage 4. Okay. Now, what are the types of tumor markers? But before that, I want you to take note and remember, no, tumor markers is specifically used to monitor cancer. Yun talaga eh. This is the ultimate reason why we are assessing or quantifying tumor markers. Eh, sir, ba't po nilagay yung detect? Actually, detect is not that useful for tumor markers. Why? Later, I will tell it again. I will tell it naman. Bakit hindi? Because tumor cells or tumor markers can be seen in normal cells. Can be seen in normal cells. So if we are going to quantify tumor markers into a healthy individual, there might be a false increase or false positive result. Okay. The ultimate purpose of tumor markers or the function of this one is to monitor cancer, actually recurrence, treatment of the cancer. Okay. Produced by tumor directly as an effect of tumor on the tissue. Now, what are the types of tumor markers? Madali, bibigyan ko kayo ng mnemonics. Horse. Tumor, horse. Tumor, horse. Ibig sabihin mo, sir, ng tumor, horse. H-O-R-S-E. These are the types of tumor markers. You will encounter or you will see here that there are enzymes that can be considered as tumor markers. There are proteins that can be seen as tumor markers or act as a tumor markers. There are receptors that can act as a tumor markers, oncofetal antigens, and even hormones and metabolites as tumor markers. Okay? So when we said hormones and metabolites, this includes specific markers for secreting tumors. Let's say, for example, beta-HCG. Sir, wait, I beg to disagree. Beta-HCG is a hormone secreted during pregnancy. During the first trimester of pregnancy, doon mataas ang beta-HCG natin. Yes, you are correct. Again, I will not contest on that. But there are cases that beta-HCG is not an indicator of pregnancy, but rather of a cancer, ovarian cancer, and even testicular cancer. Okay? So you boys, gentlemen, we are going to do this in laboratory sooner or later. If you will use your urine and you have a positive reading in the urine, okay, we have to evaluate something. Because beta-HCG in men suggests that there is a testicular cancer. Okay, it's a hormone. Metabolites, let's say for example, is the VMA and the MHVA. VMA stands for the vinyl mandelic acid, and MVA rather. MVA. Oh wait, VMA. VMA stands for vinyl mandelic acid, and we also have the HVA. What is HVA? Homovanillic acid. So you have the MVA and HVA. VMA pala. Ano ba, Mark? We have the HVA, it is homovanillic acid, and we have the VMA, vinyl mandelic acid. Those are metabolites of what we call catecholamines. Okay? That can be served also as our marker for tumor. Oncofetal antigens like your carcin embryonic antigen and even alpha-fetoprotein, AFP. If you still remember, AFP is produced, majority of that is produced by fetal lung, no? That can be used for the assessment of its distress in the fetus. And AFP, no? Ay pwede rin natin gamitin as a tumor marker. Receptors such as estrogen progesterone receptor. You can use this. The ERPR receptors for breast cancer. Serum proteins such as micro or beta microglobulins and immunoglobulins can be used as our tumor markers and enzymes. Before the advent of tumor markers, we use enzymes to correlate in certain extent of tumors or to correlate in cases of cancer. Bakit? Ano yung meron sa enzymes? Again, if we are going to recall the function of enzymes, kailan sila mataas? Kapag mayroong tissue destruction. There are also cases that sinasabi ko sa inyo yung nagmimimicry. Ginagaya niyo yung function ng adjacent organ. Yung nagiging dahilan kung bakit there is an increase in the production of the enzymes. No? Yung tumor, minimimic niya yung function ng cell. That's why there is an abnormality in the increase or abnormality in the level. Merong increase. Okay? So remember, tumor horse is the types of tumor. Hormone, oncofetal, receptors, serum proteins, and your enzymes. Now, how are we going to do this? Paano natin ma-evaluate? No? Screening, usually biopsy. Surgical operation, removal. FNAV, usually FNAV for throat cancer or for thyroid cancer, fine needle aspirate biopsy. Less invasive. Ayun nga lang, tutusukan ka ng tutusukin. Hanggang sa may makuhang tissue. Aspirate. But it involves deeper organs di open surgery. Pwede din naman FNAB. Alam ko tanong mo yun, pwede ba FNAB? Pwede din naman. Pero usually, kagaya ng sinabi ko, kapag may, kasi the purpose of that is to remove the cell, the mass, the bukol. Kung FNAB lang yan, saka pa lang natin tiningnan yung result, teka lang, baka huli na yung lahat. Kung removal, at least, once and at least, natanggal agad natin. Like what I've said, usually tumor markers is used for recurrence and effectiveness of the medication. Kapag screening, usually, ang pwede lang natin gamitin is the PSA, Prostate Specific Antigen. So that can be used for screening, diagnosis, and prognosis. For diagnosis, high levels indicative of disease. High levels of these analytes is an indication of the disease, is an indication of the cancer. Metanephrines, HVA, this is what I'm telling you a while ago, HVA and VMA. Again, these two, remember these two, are metabolites of catecholamines. Prolactin. Prolactin is an hormone. No? But we can use that as a tumor marker. Parathyroid hormone, the same thing. Chromogramin A, cortisol, and ACTH. Adrenal adenocarcinoma. No? Adrenal adenocarcinoma. When you set again prognosis, high levels associated with poor prognosis. Okay. Receptor status used to indication of the chemotherapy. Example of the receptor, the ERPR. Kapag mataas ang mga yun, napatingin natin ano yung meron. Okay. Monitoring and treatment, monitor efficiency of chemotherapy, residual disease after surgery. This is the heart of performing tumor marker. Ayan talaga yung purpose kung bakit tayo nagto-tumor markers. To detect if merong chance of recurrence ng cancer. And at the same time, check natin if the chemotherapy is doing good sa pasyente. Now, example of which is the CA125, the CA19-9, CEA-AFP, HCGPSA, and SPE. Now, how about detection of recurrence? Increase associated with relapse. Okay. Ano ito mga to? CA153, CA125. Okay. I still remember my workmate before. Mayroong pasyente kami na nagpapa-CA125. Ang sabi niya is, the patient is requesting for CA123. Are we capable of doing that? Kano pa siya? With full conviction and pride na yung pasyente ay magpapa-CA123. I was thinking that is CA153. Yung siya masabi, baka CA125. So, CA125 niya. Okay. Kasi sabi 1, 2, 3. So, baka ako yung 5, akala niya 2. Okay, so something like that. So, these are the types of tumor markers. PSA can be used for screening. There can be used for diagnosis. There can be used for prognosis, monitoring, and recurrence. But again, take note that these two is the major reason why we are doing tumor markers. Okay? Most tumor markers are found in normal cells, not just in cancer cells. That's why, ito yung sinasabi ko sa inyo kanina, no? Detection of tumor markers in asymptomatic population can result into false positive, causing undue alarm or cost. If you know, this is a Tagalog movie by I. de las Alas, ng tanging inan mo last night to. Di ba nalaglag siya sa hagdan? And then, sabi dun sa x-ray, nakakatawa namang movie, sabi sa x-ray, meron daw cancer, may tumor sa utak. Okay? So, ganoon namang nangyayari. If we are going to test normal people sa ating mga cancer sa ating mga tumor markers, undue alarm or cost. Okay? New tumor markers are used to screen population. Now, remember this. Susceptibility to breast, ovarian, and colon cancer can be determined by identifying germline mutations. What do we mean, sir, by germline? Germline means a sex cells. No? This is a cell lineage containing and transmitting genetic information from one generation to another. Again, when you said germline, that is a sex cells. Okay? A sex cells that is capable of cell lineage now that contains genetic material and also responsible for transmitting genetic material from one generation to another. Okay. So it's nice to measure the germline mutations or to detect if there's a germline mutation in cases na may mga breast cancer or those who are susceptible of having a breast cancer. That's why kapag may cancer, ano yung laging tinatanong? Do you have the history of cancer in the family? Alam ka naman yung kapitbahay mo nagka-cancer tapos ikaw ay yung may history. Tapos sasabihin mo, ako yung kapitbahay ko po may cancer. Ano yung kinalaman ng kapitbahay sa'yo? Unless otherwise, yung kapitbahay mo, you have the same genes. Baka kapatid mo talaga yun, di ba? That's why pag may cancer, nilaging tanong, do you have a history? Most especially in these cases, no? Breast, ovarian, and colon cancer. Now, we also have what we call BRCA1 and BRCA2. Ano yung BRCA? BRCA, BRCA. Yun ang tawag sa laboratory. BRCA1 and BRCA2 mutations. Yung mga magandang thesis sana eh. Yung mga experimental thesis. Tapos in connection to molecular biology. Molecular level of BRCA and BRCA1, BRCA2 mutations. Tingnan natin. Now, what do we mean by BRCA? BRCA. BRCA stands for breast cancer gene. Okay? BRCA stands for breast cancer gene. Huwag na natin prolobahin bakit A. E di cancer. No? Breast cancer gene 1 and breast cancer gene 2. Mutations. So may mga breast and ovarian cancer. Ano yung mahalaga doon? Ano yung meron doon? When we said BRCA, no? This is important in fighting. No? These are tumor suppressor genes. These are important to fight breast cancer. Well, of course, ovarian cancer too. Again, remember, breast cancer and ovarian cancers are associated with germline. Again, when you said germline, these are sex cells containing the genetic information that's capable of transmitting the gene information from one generation to another. When we said BCRA or BRCA1 and BRCA2, these are breast cancer antigens that is responsible for fighting against breast cancer. And when we said colon cancer, we also have what we call the adenomatous polyposis coli gene, or also known as what we call the APC. So what does it mean? It means that no, this is a tumor suppressor gene. A tumor suppressor gene, okay, for colon cancer. Now, tumor markers concentration gradually increases with tumor progression. Kaya nga hindi siya magandang gamitin. Ang tumor markers, hindi siya magandang gamitin for prognosis, for diagnosis. Okay? Because at some extent, mataas siya or detectable siya, but not that too high. Since even normal cells can have the presence of that. But once we reach the highest level, it means that the tumor markers are metastasizing involvement in other organs. It is also nice to know that tumor marker levels at diagnosis can reflect presence of malignancies and aggressiveness of tumors and can help predict the outcome. Medyo nakakalito, sir. Ano sabi mo kasi, hindi talaga siya magandang gawin. Oo. It is not nice or recommended to perform tumor marker to know if the patient is having a cancer. Because there are cancer na mayroon ng poor prognosis. At kapag poor ang prognosis natin, yung po mga tumor markers natin, hindi siya ganun kataas. Mataas siya, but not to the extent that it will give us an idea. It will give us a conclusion. It will help us to draw a conclusion that the patient is really suffering from the cancer. Tumor markers is evident kapag mayroong metastasis. Tumor markers is evident kapag hindi maganda yung effect ng gamutan sa pasyente. Kaya nga paulit-ulit kong sinasabi sa inyo, and I keep on repeating this because I want you to remember that tumor markers can be used for prognosis, but it's not a reliable marker since konti lang yung mga tumor markers that we can use for prognosis. And the better one, do the tumor marker analysis. Kung na-detect talaga ng doctor na mayroong cancer. The best way to detect cancer is to perform histopathological tests to know if the tumor is benign or malignant. Pwede siyang gamitin, pero hindi ganun ka-reliable marker. Mapura na lang kung may aggressive tumor ang pasyente. Pero the doctor will not do that. Because once the doctor see that there is a mass, there is a book hole, ano yung laging sasabihin? Operahin natin, tanggalin natin. Okay? Monitoring therapy effectiveness and disease recurrence is the heart of performing tumor marker. Ano ba yung ginagawa kapag mayroong nakitang tumor at itong tumor nito is an example, the tumor is classified as benign, malignant, malignant tumor. Siyempre, meron tayong surgical removal. Alam ka naman nating titigan na lang yung kumog na yan, yung tumor na yan. Na parang inaagdas na kandila ang isang tao sa sakit because of the tumor. We have to remove that. Perform necessary test, histopathological test to know if that cell is a cancer cell. Ano yung ginagawa? Nagkakameron tayo ng radiation therapy and even chemotherapy. Diba? And how do we know that the chemotherapy or even the radiation therapy is effective to suppress the multiplication or the metastasis of the cancer cells? Evaluate the tumor markers. Kung mataas pa rin ang tumor markers mo, ay expected yan, katatanggal-tanggal lang yan. Ano yun? Pagkatanggal mo ng cell, ng malignant cell, expect mo mababa agad ang tumor markers? Hindi. Kung natapos na natin ang chemotherapy at mataas pa rin yung tumor markers natin, then that's the time that we have to re-evaluate the medication. After chemotherapy, hindi ka na pwede mag-undergo ng chemotherapy, mag-radiation therapy ka na. And after radiation therapy and still tumor markers is increased, then you have to subject yourself for immunological therapy. Like what happened to one of our faculty members. Okay? Again, effective therapy can result in decrease in the tumor markers. So kung mataas pa rin ngayon tumor markers mo, that's what I keep on telling a while ago. The chemotherapy or the therapy that's being done to you is not enough to suppress the activity of the tumor. Appearance of tumor markers after effective therapy can be used as a high-sensitive marker of recurrence. No? Handa mo. Appearance of tumor markers after effective therapy can be used as highly sensitive marker for recurrence. Natapos naman ng pasyente ang 6 cycles of chemotherapy. And after performing tumor marker test, the patient still have a high result in tumor markers. Then that means that the cancer can come back. Oh, buti pa yun, may come back. Diba? You heard it. The doctor will proclaim, or the doctor will say, you are cancer free. But after a while, excuse me, after quite sometimes, mas malala na pala. Okay? Because of the recurrence and the involvement of other organs. Now, what are the laboratory considerations for tumor marker measurement? Number one, multiple test samples should be performed using the same commercial kits. Bakit? Eh baka kasi yung specificity, commercial kits ang sinasabi natin dito. Baka magkakaiba yun ng specificity at saka sensitivity. Dun sa isa sobrang taas ng result. Tapos dun sa isa hindi. Hindi na reliable. Okay? And another problem of performing tumor marker is the lack of standardization. Bakit? Not all hospitals are capable of performing tumor marker analysis. Bakit? Hindi naman siya routinely performed. Eh bakit sir? Eh ba hindi naman lahat na nasa ospital may cancer. Unlike diabetes, those do may mga hypertension, common yan. Kaya we can standardize. Wala. Merong standardization, but there is missing. Merong nawawala. Okay? Securely evaluated tumor markers because they increase with time, whereas normal values will not. Please take note of that. Now, like well said, standardization found for other common clinical assays generally does not exist for cancer assays because of the different specificity and principles that can be used in our cancer or in our tumor markers. Now, the comparison of results from different assays from a single patient can be treacherous due to differences in antigen specificity or antibody specificity, analyte hereto or heterogeneity or genity, assay design, lack of standardization reference material, calibration and kinetics, variation in the reference ranges. These are the reason kung bakit nga we can't have a standardized result for tumor markers. Because of the test kit itself or because of the principle of each machine. Okay? Now, what are the test methods that can be used to analyze our tumor markers? We have immunoassays. Immunoassays is the most common, be it EIA or ELISA. No? That is the most common method to measure tumor markers. Bakit? Kasi pag immunoassays, automated. The ability of being automated. However, there are also immunoassays na manual. Example, yun nga, mga kit-kit yan, manual yan. Okay? Now, there are factors that affects the interpreting of tumor marker in immunoassays. What are those? Please take note: linearity, hook effect, and heterophile antibodies. What do we mean by linearity? The range of analyte concentration in which a linear relationship exists between analyte and signal. Okay, measured by analyzing specimens spanning a reportable range. How about hook effect? When we said hook effect, that is falsely low measurement as a result of excessively high tumor markers and concentration. There is a high tumor marker pero mababa ang ating measurement. That is what we call hook effect. It is typically seen as a capture and label antibodies as are saturated, resulting in the lack of what we call sandwich formation. Ano ba yung ibig sabihin ng sandwich? In immunology, i-discuss yan sa inyo. Ano yung sabi doon? Yung mga immunological assays, yung sandwich, wag sinabi na yung sandwich, there are two layers of antibodies. At ang nasa gitna niyan yung antigen. Okay? Sandwich analysis. Okay. Examples exceeds linear range should be diluted and retested. And again, sabi natin, kapag dinelute, nagkakameron tayo ng problema. Now, how about heterophile antibodies? When we said heterophile antibodies, these are circulating antibodies against animal immunoglobulins that can cause significant interference in the immunoassay. Usually, we're using mouse or rabbit antibodies dyan sa mga immunoassays natin. Gumagamit tayo ng mouse antibodies, and rabbit antibodies sa mga immunoassays. And that can be the cause of interference. Let's say, for example, a mouse monoclonal antibodies that can occur in the patient, yun yung ginamit mong principle in the test. Ano ba ibig sabihin ng monoclonal antibodies? When we said monoclonal antibodies, it means it mimics the immune system ability of the person, of the human. Okay, that's the problem in immunoassay. Again, what are those? We have the linearity, hook effect, and we have the heterophile antibodies. Now, what else? Aside from that, aside from immunoassay, we have what we call high-performance liquid chromatography. Okay? And HPLC naman is used for the detection of catecholamines and its metabolites in the urine and plasma. Example nga ng metabolites of catecholamines is the one that I mentioned a while ago. What are those? The VMA and the not VMA. The VMA and the HVA. The analyte of interest are separated from plasma or urine, run over a column, and separated by physical characteristics. Okay. And HPLC, aside from widely used for catecholamines, ito yung ginagamit natin for neuroblastoma, pheochromocytoma, and carcinoid tumors. Aside from that, yung ating mga histological stains. Well, I'm sure this was mentioned to you, yung ating tinatawag na immunohistochemistry staining. Immunohistochemistry staining ito na yung pinauuso. Bakit? Mas effective daw. It is much more effective to detect the abnormalities in the cell. Bakit? Because we are not only looking on the structural pattern of the cell itself, but also we are using specialized stain. We are using immunohistochemistry stain. Immunohistochemistry stains to detect the presence of antigens in the tissue. Ibig sabihin, the pathologist himself or herself can visualize the abnormalities in the structural pattern. And at the same time, take note and at the same time, nakikita na din doon yung antigens. Bakit? Because of the specialized stain. Yun nga lang, mahal. But maganda ang result. Pwede ba sabi, HNE is the routine stain? Oo. HNE naman talaga. But we can use immunohistochemistry stain. And that the illustration here and on the left side of the screen shows ano yung itsura ng cells na may cancer under HIC or immunohistochemistry staining. I was able to attend a training on how to perform immunohistochemistry staining. And I appreciate it. Advancement in the histotechnology. Like what I've said, enzymes can be used for our tumor markers. Pero yun nga lang, not because there is an elevated enzymes, we cannot rule out that is for cancer. Hindi porket mataas ang enzyme analysis natin, mataas ang GGT, mataas ang ALT, ALP, ay sasabihin na natin na may cancer ka sa liver. No, because as we agreed, enzyme assays or enzyme activities are increased in cases of there's a destruction in the pattern of the tissue. But since kung meron talaga siyang cancer, ang sabi dito, detection of elevated circulating enzymes generally cannot be used to identify specific tumor or site of tumor. Well, bakit? Hindi naman well-confined ang ating enzymes. Bakit? Well-distributed nga siya eh. Kaya nga sabi natin, there is no specific tissue-specific enzyme. At to what extent pa ginagamit yung enzyme natin? To know the activity of the tissue. Involvement of the tissue. Okay? Well, except for PSA, because PSA, prostate-specific antigen, can be found exclusively in diseased or benign prostate glands. Okay? Take note of this. Before the use of immunoassays and fetal antigen was common, enzyme detection was widely used. Kasi sir, bakit siya nataas kung ulit-ulit mong sinasabi, mayroong tissue destruction? Bakit nga ba tumataas? Ito yung tissue destruction. Ano ba yung nangyari dun sa structural pattern natin ng tissue? Merong destruction. Meron nga siyang degenerative change eh. And what is that? Neoplasm. There is another cell that originates from that cell, and that another cell called as the neoplasm should not be there. And the characteristics of our neoplasms or of our tumor cells, it is its capability to mimic the action of the cell. Kung sira na nga the cell is destroyed, the higher the activity of the enzyme is, then the tumor will mimic that. Now, what are the enzymes that can be used as tumor markers? ALP, for bone, liver, leukemia, and sarcoma. Creatine kinase BB or CKBB, prostate, small cell lung, breast, colon, and ovarian cancer. Lactate dehydrogenase, liver, lymphomas, and leukemias. Hodgkin's lymphoma, okay? And PSA, prostate. Now, let's discuss the clinically significant or most widely used tumor markers. Let's begin with AFP or alpha-fetoprotein. We all know that alpha-fetoprotein is an abundant serum protein. Protein pala siya. Bakit siya naging cancer cell or tumor marker? Di ba sabi natin kanina? Okay, proteins, secreting proteins natin can be used as a tumor marker. And take note, huh? If you still remember, sabi natin, AFP is produced, majority of that is produced by fetal lung. Fetal liver during gestation. Okay. That's why AFP is often related in patients with hepatocellular carcinoma and germ cell tumor. Okay. This is related to albumin, normally function as the transport protein and involved in regulating oncotic pressure in fetus. Okay. What else about our AFP? AFP can be used for diagnosis, staging, prognosis, treatment, monitoring of hepatocellular carcinoma. Ito'y tandaan mo, isulat mo ha. Diagnosis, staging, prognosis, and treatment of AFP, of hepatocellular carcinoma. AFP, aside from being used for hepatocellular carcinoma, we can also use that for testicular cancer, monitoring of testicular cancer, and at the same time for tumor staging. Okay. There are a variety of immunological assays for the detection of AFP, like this one. Ano yung problema dito? This is just a qualitative test. Bakit? Positive, negative lang yan ng AFP. How can you quantify kung positive lang? Ano ngayon? If that can be seen in a normal individual, we have to quantify. Again, take note of this, no? The upper limit, the lower limit, the normal lower limit of serum AFP, it should be equivalent to 15 nanograms per ml in adults. Again, we can use AFP for prognosis, staging, diagnosis, and treatment monitoring of hepatocellular, used for classification and monitoring of therapy for testicular cancer and tumor staging. Now, how about cancer antigen 125 or CA125? Ito yung palatandaan dito. CA125, yung 5 daw B. Pag B, buntis. Para magbuntis ka, kailangan meron kang ovary. Ovary, CA125. No? Used for detecting ovarian tumors at early stage and monitoring, of course, of our tumor marker for ovarian cancer. Now, expressing the ovary, other tissues of the Mullerian duct origin. Sir, what do we mean by Mullerian duct? Okay, it's nice to know. What is Mullerian duct? When you said Mullerian duct, that is a primordial uncle of the female reproductive tract. Take note that Mullerian duct is essential for the development of the urogenital system of the female. Okay, CA125 for cancer in relation to ovary. Okay, that's the only clinically significant serological marker for cancer, CA125. Now, for methods, immunoassays use OC125. Ano naman sir yung OC125? When we said OC125, that is a monoclonal antigen, monoclonal antibody that is raised against the tumor cells from the patient with cystoadenosine. Again, I repeat. When we said OC125, it means that this is a monoclonal antibodies raised against tumor cells from patient with cystadeноcarcinoma. Cystadeno, sulat natin ng husay. Carcinoma. Ano po yan? It is a rare type of neoplasm. Okay? And OC125 reacts with CA125. That's why immunological tests or assays use OC125. Or we can use M11. What is M11? That is immunoglobulin M for the detection of CA125. Now, how about carcinoembryonic antigen or CEA? Okay, carcinoembryonic antigen is used for or is expressed during development and re-expressed in tumors. No, this is a tumor marker for colorectal cancer. Kaya nga, no, intestine. Colorectal cancer and also evaluated in lungs, breast, and even in GI tumors. So take note that CEA is not only confined sa colorectal cancer because we can use CEA also because it is also elevated in cases of lungs, breast, and GI tumors. Okay? It is also involved in apoptosis. Again, when we said apoptosis, that is what we mean the programmed cell death. On the other hand, tumor markers, aside from being a tumor marker for colorectal cancer, we can use this for the prognosis and for post-surgery surveillance, which means for monitoring of the therapy. Okay. Historically, they use polyclonal antibodies for the detection of CAA, but now we are now using the monoclonal anti-CAA antibodies. Now take note also of this one because of high heterogeneity of the CAA. It is essential that the same assay should be used for serial monitoring. And this is also the reason why that we have to use the same principle, the same kit for tumor markers because of the heterogeneity of our tumor markers. How about human chorionic gonadotrophin? Like what I've said a while ago, human chorionic gonadotrophin is can be used for ovarian cancer. Okay. And at the same time, for testicular cancer. Kaya yung lalaki, kapag nag-positive ka din at mataas ang HCG mo, and you have to take note. Teka lang, there's something wrong. But I want you to take note of this because human chorionic gonadotrophin has two subunits, the alpha and the beta subunits. The beta subunits is the one typically for pregnancy. Yung beta HCG, yun yung mataas kapag may pregnancy. And even in cases of testicular and ovarian cancer. Take note that the beta HCG is increased, or the peak of beta HCG is seen during the first 3 months of pregnancy. Kaya nga, if the pregnant is still positive or mataas pa rin ang kanyang beta HCG during the terminal stages of pregnancy, she has to subject herself, she has to subject herself saan? Sa blood beta HCG. Para malaman natin yung level. Okay? Used for prognosis of ovarian cancer and diagnosis of testicular cancer. Usually, marker for gestational trophoblastic diseases. Okay, now how about prostate-specific antigen? Take note, ito ginagamit na to, di ba? For diagnosis. Take note that PSA regulates seminal fluid viscosity. Di ba? Sabi nga natin, yung prostate fluid, majority part ng major part ng semen. No? That involves in the viscosity and even the acidity. Okay. It dissolves cervical mucosal cup, allowing the sperm to enter. Saan? Sa egg. Okay. Now, low levels of PSA can be detected in serum of healthy men. And you know guys that at the age of 40, dapat yung pasyente ay nagpapa-PSA every year. Okay? Kasi ito yung common cancer sa mga lalaki, prostate cancer. Now, there are two forms of prostate specific antigen, the free and the complex one. Okay? Over 50, yung risk of prostate cancer. No? According to Bishop, 50. But according to the doctor na nakausap, yung pathologist namin, nung nasa hospital ako, dapat to at the age of 40 pa lang, nagpapacheck na ang mga lalaki ng PSA every year. Okay. Normal is less than 4 nanograms per ml. There are a wide range of methodologies for prostate-specific antigen. It includes enzyme immunofluorescence, chemiluminescence, and automated immunoassay platform for PSA. Now, for the synthesis of our topic, again, remember that tumor markers are used. Majority of tumor markers is used for the recurrence or monitoring of the recurrence and effectiveness of the monitoring of the effectiveness of the medication. There are some tumor markers that can be used for prognosis and even in diagnosis. There are 5 types of tumor markers. Hormone, okay? Yung horse natin, na mnemonics, tandaan ha, horse. We have the hormone. We have the oncofetal antigen, receptors, serum proteins, and we have your enzymes. Before, the use of oncofetal antigens and receptors, enzymes is widely used. However, we cannot rely on enzyme analysis because increase in the activity of the enzyme will not suggest on what organ nag-originate ang ating tumor markers. Okay? I have here an illustration that will give you an idea of what are the tumor markers that can be used to assess the effectiveness of the medication. For lung cancer, we have 1 to 5. CEA, liver cancer, AFP, okay, prostate, PSA, testicular, AFP, ovaries, 125 CEA, pancreatic, 125 CEA, colon, CEA, stomach, CEA, breast, 125 CEA, HER2, HER1, BRCA1, BRCA2. Okay. And here is the summary of the tumor markers. Again, AFP is clinically associated with hepatic and testicular cancer, ALP, an enzyme for placenta lung cancer, amylase pancreatic, BRCA1 and BRCA2 is for breast and ovarian cancer, CA125 ovarian, CA153 is breast cancer. Ano yung palatandaan natin dito? Medyo matatawa kayo, no? CA1153, ulat ko para mas mag 153. Lagyan mo daw ng talibang tuldok doon sa 3, that is for breast. Okay? CA19-9, 19.9 is for pancreatic, gastric, and colorectal. Para daw matandaan natin na pancreatic yung 9, shape ng pancreas. CA50, gastric and pancreatic cancer. CA27.29 is for breast cancer. Calcitonin is for medullary thyroid cancer. Cathepsin B is for breast cancer. CEA, colorectal, stomach, breast, lung cancer. CK1, small cell lung cancer and prostate cancer. We also have the estrogen receptor and even the progesterone receptor. The ERPR is for breast cancer. GGT, gamma glutamic transferase, hepatoma. No? HER2 and HER2-neu for breast cancer. Nuclear matrix protein or NMP is for urinary bladder cancer. And we have the cytokeratin fragment 21.1 is for lungs and breast cancer. And that is the end of our discussion about tumor markers. Again, I am asking you to scan this QR code to evaluate your satisfaction in this asynchronous class. Thank you very much and God bless you all.